Hello, I'm Dan Daly, the founding executive director of the Center for Theology and Ethics in Catholic Health. Today, I'd like to share with you a little bit about the mission and values of the center. I'll begin by discussing the logo, as it communicates the overarching perspective of the center. There are two parts of the cross symbolizing the humanity and divinity of Jesus Christ, which is fully revealed in Jesus' crucifixion and resurrection. Red is the traditional color of the Holy Spirit and symbolizes God's grace in the world. Notice that red is being suffused from left to right. This represents God's grace moving into the human person. God's grace is healing and elevating, making possible the ongoing healing ministry of Jesus Christ, which is the mission of Catholic Health. Catholic Health is a graced ministry, cooperating with God to heal the sick. The center was created to address complex issues in Catholic healthcare, theology, and ethics, so that providers may more effectively continue Jesus' healing ministry. It is a research center that produces faithful moral guidance to Catholic health. The center draws on the Church's teaching and the best expression of Catholic theological ethics in dialogue with other relevant disciplines. It serves the theological and ethical needs of our partners in Catholic Health and the United States Catholic bishops. The center responds to these constituencies. It achieves its purpose through close relationships with leaders in Catholic Health and the bishops. The center is at the service of Catholic health, the Church, and the world. The Second Vatican Council invites Catholics to be a leaven in the world and to elevate the dignity of each person. The center endeavors to promote human dignity in religious and public discourses in healthcare ethics. It does so in two ways. First, the center communicates what the Church believes and teaches about the human person in healthcare ethics. It seeks to analyze issues in light of the fullness of the Catholic moral tradition, including the intrinsic human dignity of all persons, the consistent ethic of life, the common good, and the virtues. Second, Catholic healthcare ethics has much to contribute to secular healthcare ethics. Catholic healthcare ethics is ultimately a human ethics. We promote dignity because we are Catholic, and we encourage others to promote dignity because they are people of goodwill. The center analyzes issues in Catholic healthcare ethics through the principle of universal human dignity. Dignitas Infinita, a declaration by the Dicastery on the Doctrine of the Faith, argues that because each person has infinite value, she should have what she needs to flourish as a person, including medical care. Our belief in human dignity means that we are consistently pro-life. Echoing Jesus' mission to offer all persons life and life in abundance, St. John Paul II teaches us that to be a pro-life Catholic is to be on the side of life and human flourishing on all issues. These values inspire the center. The center is also inspired by Pope Francis's culture of encounter, which calls for people to connect with and understand each other. Healthcare ethics requires an understanding of how healthcare affects the lives and well-being of patients and communities. Therefore, the center meets and dialogues with medical practitioners, patients, and members of vulnerable communities. My hope is that in the coming months, years, and decades, the center will be a place of rigorous theological inquiry and intellectual charity in service of Catholic health, the Church, and the world. I invite you to engage with the center's work.